Welcome to Chamber Chats, a weekly series by the West Monroe West Washita Chamber of Commerce highlighting our valued members. As always, find out more about the Chamber and our members online at westmonroechamber.org. And now, this week's episode of West Monroe West Washita Chamber Chats.
Welcome to this episode of Chamber Chats. This episode is filmed at Louisiana Delta Community College, and we are proud today to have Mark with GoCare. Mark, tell us a little bit about GoCare as a service.
Okay. GoCare is a community health center. We're actually a federally qualified health center lookalike, and we provide medical care, support services, and behavioral health to people who are medically underserved. We are underinsured, uninsured, low income, and we provide it in an affirming and inclusive environment.
Wow. So can you tell me just a little bit more, like when you're talking about that population, who give us some examples of that population itself?
Sure. So people who may be lower income, people who may think they can't afford health care anywhere else, quality health care anywhere else. We have if we have someone who makes under 100% of the federal poverty guidelines, they can come in and just pay $10 for an office visit.
You were mentioning a sliding fee scale.
Mm-hmm. It's income based.
But also someone that does have insurance, like I could come and
Absolutely.
take advantage of your services.
Absolutely.
So what are some misconceptions about GoCare?
Well, the GoCare name carries a long tradition in Northeast Louisiana. People who are familiar with GoCare think that's the HIV organization.
Right.
And, for a number of years, that's what we were.
Sure,
That's how we
sure,
started. We
sure.
began in response to the global HIV epidemic back in 1988.
Again, an underserved population.
An underserved
Right.
population. And, as time evolves, so do organizations.
Sure.
I came on board in 2016 and became CEO in 2017. And the board that we've had in place, and I, since that period of time, have seen the real need to expand our service model and integrate HIV care into regular primary behavioral health.
Yeah.
To, one, that destigmatizes HIV
Sure.
care because people are receiving care in the same place that everybody else is.
Right.
And so we have had tremendous growth in that area. I was speaking with our CFO and with my assistant before I left here, and it's kind of mind-boggling to realize that we have grown since 2020. We've gone from 23 staff people to 42 staff people since the beginning of 2020, and we have a $3 million annual payroll now, and it's just mind-boggling to me.
And I think that goes to good leadership. Y'all are very attuned to the needs of the people you serve, but you're also attuned to what the future looks like for that need. And instead of being reactionary, you've been anticipating. And that growth is beautiful, but it's a testament to leadership too, right? And you've got not just yourself as a talented person, but you've got a talented team.
We have really worked hard to put together a very diverse, a very caring team. Whenever we hire new people, one of the things I ask is, okay, you've seen our mission vision, you know the population that we deal with. I need to know before you come to work here, are you supportive of the populations that we work with? Because if you're not fully embracing of all the people that we work with, then this may not be the place for you.
Sure. Yeah. And as a result, your clients are leaving feeling empowered that they're getting access to quality care, meeting their needs and where they're at.
Absolutely.
So I love that. So what is, like, if you had to reduce down your mission and your vision into one sentence, what is that?
If I could boil it down.
I know it's a challenge.
Yeah.
Give me one sentence.
We want to provide affirming and inclusive, comprehensive care to the people of Northeast Louisiana.
I think that's beautiful. But so tell me, you and your staff, what brings you joy? Because healthcare can be daunting, right? You're seeing people sometimes at their worst, most mentally and physically. So what motivates you and brings you joy in that position?
What brings me joy is having someone who has either been reluctant to go get health care because of stigma,
Sure.
or where they've been reluctant to receive health care because of a fear of cost, where they come in and they say, I have never been treated like I've been treated by the staff at GoCare. From the front office to the nurse, to the medical provider, to the behavioral health provider, to the support service people. They said, I feel like I've been treated as if I'm worthwhile. And that's what because any new person that I bring on board, I say, when I have a patient that walks through our front door, I want them to feel like they're coming into my living room. Like they're being welcomed into my house.
This is a home.
It's a home.
Yeah.
It's a home.
So how do people find out more about GoCare?
It's very easy. You just go to go-care.org, and we have a fairly comprehensive website. We're going to be revamping that in the near future, and we have some exciting things on our horizon. Is it okay to give you a little teaser of what we're doing? So since we have gone through such tremendous growth, we're currently in a 6,000 square foot facility on North 7th Street in West Monroe, and we're at capacity. But in
a good way.
In a good way. We recently purchased a 24,000 square foot facility adjacent to downtown West Monroe, and we're preparing to make a total $6.5 million investment to have a nice health center that's going to expand our footprint for not only medical care, but for behavioral health and some exciting new services that I'm not quite ready to share with y'all yet.
Yeah.
But we're planning on breaking ground on that remodel project in the next couple of months. So
I'm so proud to see that incomplete ecosystem for healthcare being one place that's inclusive, that gives voice to a population that's underserved, but also that it's in our backyard. It means a lot to me that y'all are doing an expansion, but that you were so cognizant to stay in West Monroe, where you've grown. Yeah. So thank you for your investment. Thank you for going the extra mile for underserved patients in our community, because that affects us all, whether we like to admit it or not.
Thank you, because those are the types of things that bring me joy. Seeing people who otherwise think they couldn't receive quality care, receiving that care and feeling worthwhile.
For more information about the Chamber, of course, you can find great members in our directory like GoCare, westmonroechamber.org, and we'd love to have you as a member. Come and join us. On the next episode, we will continue exploring our members, but we'll be diving into some of our board members themselves and their contributions to our mission.